welcome to the much anticipated Solh Talks Season 2. My name is Vandana V and I am thrilled to welcome you all to this new chapter. This season, we are delving into Asian wisdom with modern technology. We will be talking a lot about that and exploring innovative approaches to self-care and mental health. Our Season 2 is on embracing holistic well-being in the digital age. Our objective is very clear. We are here to unravel the mysteries of holistic wellness, shedding light on how we can navigate the complexities of modern life while nurturing our mental health and emotional well-being. Throughout this season, we will be sitting down face to face, doing a lot of interviews with 13 remarkable individuals, each representing diverse backgrounds within the well-being industry, from mindfulness experts to tech innovators to doctors and psychologists. Each episode will have a unique perspective, inviting you to join us in thought-provoking conversations that transcend boundaries and spark meaningful change. So, ladies and gentlemen, here we are with our first episode where you will be joined by Mr. Kapil Gupta, our founder, Soul Wellness, along with two esteemed panelists, Dr. Mary Ibrahim and Dr. Vandana V. Prakash. Dr. Mary Ibrahim brings a wealth of experience as an MD in Anesthesiology and a senior consultant in pain management at the Max Multi-Speciality Center in New Delhi. With over 35 years of expertise in neuroanesthesiology, pain, and palliative care, Dr. Ibrahim offers invaluable insights into holistic approaches to wellness. With that, our second panelist is Dr. Vandana V. Prakash, a senior consultant clinical psychologist with 30 years of practice. She adds her expertise to the conversation with an MPhil in medical and social psychology from NIMHANS, Bangalore, and numerous research papers to her credit. So Dr. Prakash brings a deep understanding of mental health and well-being in the digital age to our discussion. So, ladies and gentlemen, listen to all these three people and let's dive into the episode. Thank you very much.
Hello and welcome Dr. Mary and Dr. Vandana. It is such a pleasure to have you here on Solh Talks. Let me start with you, Dr. Mary. What is chronic pain and what makes it a biopsychosocial phenomena, and why is it more associated with psychosocial problems?
To understand this, we should know what the definition of pain is. So pain is an unpleasant, it was defined by the Indian Association of the Study of Pain way back in 1980s, but modified in 2020. So according to that, pain is an unpleasant physical and emotional experience. Okay, that is mentioned in the very definition itself. So having said that, we should understand that broadly speaking, there are two kinds of pain. One is acute pain and one is chronic pain. Now, acute pain is something that lasts less than 3 months and it just wanes away. Like, for example, after surgery, you have post-operative pain, or you have a fracture, you have pain, or you have an appendicitis, whatever, any inflammation. So, all this is acute pain because with treatment, with antibiotics, with anti-inflammatory drugs, this pain will settle down. It doesn't have so much there is an element of fear, but that is something which settles down. Like before surgery and after surgery, you're worried about the pain. But that is something that normally settles down if the pain is treated adequately, which can easily be done in acute pain. Sure. They respond to most of the medications that we give. But chronic pain is a different ballgame altogether because this is pain that has persisted beyond 3 months or much beyond the period of healing is over. But it still persists. Like a creaking gate, it goes on and on and on. So then very often the original injury may have subsided, it may persist, but the pain is definitely there. And because it is lasting for so long, it's going to have a lot of repercussions. The psychological problems, the social problems, and even spiritual problems happen. And this is what is called the biopsychosocial aspect of pain, or what is called as total pain. Now, total pain is what was defined by Dame Cicely Saunders, who was a pioneer of palliative care way back in 1960. She said that pain, and she was referring to cancer pain, that pain is not just physical. It has got psychological, social, and even spiritual repercussions. So when you treat pain, that kind of pain, you have to address all the aspects. And this is what is called the holistic management. Okay.
Hey, that's very interesting. In fact, I remember I recently was at one of the sessions of Mr. Shiv Kheda, and he was talking about pain. And in his world, it's something I didn't fully agree with, but he said acute pain is never a problem. You only need to worry about your chronic pain, but of course, it will depend on the intensity.
The only problem is when acute pain, like post-operative pain, is not treated adequately, then in 40% of patients, it can transition into chronic pain. So that is why it's so important to treat acute pain well.
Right.
And now we have got a variety of drugs and techniques by which even the most severe pain like knee replacement pain or anything can be treated adequately. That is a must.
Sure. So, Dr. Vandana, what are some of the psychological problems associated with chronic pain? If you can talk about
there are actually many psychological problems. A person may start remaining depressed because of the ongoing. Very rightly, she's used the word creaking gait. It's like a creaking gait, which is never makes you feel happy. So there's this depression is one of the most often seen problem in person with a chronic pain. Anxiety-related disorders are there. Then there's a lot of stress. There is occupational problems. You want to work, but you're not able to perform because of the pain. Or you're working from home, the adequate, that feeling of being satisfied that you've done a good job, that doesn't come because of your pain. The fact that there may be a role reversal because of your chronic pain, other members have to take up your role in the house. So, you start feeling, less important in the family, your self-esteem takes a back seat. So, there are so many things which are associated with chronic pain, especially even biological functions like sleep. Your sleep gets disturbed, so you never get a feeling refreshed. It starts affecting your appetite also. Even in depression, we see the same thing, So they're all very interconnected when you see the physical aspect as well as the psychological, social aspects of it.
Sure. And while people would normally talk about biology as something which is universal, or at least, it would be similar all across the earth, but really, pain by itself would have different ramifications in different parts of the world. So what are the social problems associated with chronic pain, and how are they different in our country when vis-a-vis when it is compared to some of the Western countries or some of the other parts of the world?
See, in our country, there are two things which are very good and also things which are not too good. In our country, we still have by and large family support, and including joint family system, which I always say is something we should not give away in our country. Because then people are taken care of.
Sure.
So it's a natural caregiving system, which in the West is not the same. So they have different kind of problems when chronic pain is associated. Who will earn? Who will give them food? Who will cook for them? Will they be put into an old home or some other rehabilitation center? Whereas we don't have that kind of problems here. We know we are at home, there are people to look after, and something will be done. The only thing is that role reversal is something which is, especially if the head of the family has chronic pain, the wife takes over, so he is no longer the decision maker. So, that kind of relationship problems result.
In this context, I just want to give two examples. I had a patient who was a supervisor in Metro, not educated, maybe 12 plus, but he was working as a supervisor. He had this chronic pain, and he had to do a lot of running around, climbing up ramps, and he couldn't do it because of his back pain. Now, he was a single breadwinner. He had two small children, wife and parents in the village. And he was the only breadwinner. Sure. And his employer told him that, see, with this kind of pain, you can't work. You first take care of your pain and then come back, and if the job is available, I'll give it to you. Sure. He came to me in that situation where he had no place to stay, and he was just trying to, in fact, that incident is quoted in our book, we are quoted in our book. Sure. But then what I did is I started treating him, but then I told him that now you must try to get back to work. Fortunately, his employer was an understanding guy who took him back. And now he's working and supporting his family, and he's learned to adjust whatever the pain is. The other thing is, in the West, we were talking about the West. Now, even for chronic pain, they are prescribing opioids. Yes. So there is what is called an opioid epidemic happening over there, because it is indiscriminately prescribed by any practitioner. They just go to them and they are giving the strong opioids. So that has caused so many deaths. Like in 2020, there it's about 1 lakh deaths in a year, as compared to 10,000 in 2010. So in 10 years, COVID pandemic, so many things, 300 deaths every day. That's the kind of thing. Fortunately, in our country, we have got very strict NDPS laws. So as a result, we are not prescribing strong opioids for chronic non-cancer patients.
Sure.
Only for cancer pain we are giving it. So our laws and our attitude of our doctors and the patients, everyone has helped. So this is the difference in the social part of the pain.
Sure. And for some of our viewers who wants to know more about opioid and opioid pandemics, there is a documentary on Netflix which is actually about Purdue Pharma, one of the major culprits, multi-billion-dollar company that actually went bankrupt because the government forced it to go bankrupt because of the opioid crisis and all the terrible things that they did during that time. So one important aspect, as you talked about chronic pain, and you mentioned that if acute pain is not treated correctly, it will become chronic.
It can. Only about 40% of people.
Right. So even chronic pain, chronic pain will need to be treated very holistically.
Yes.
So what would be like a multimodal approach to managing chronic pain?
Alright, so I think you should tell first about medicines.
So when a patient comes with chronic pain, they come in a state when they are very, very dejected, disappointed, disabled. Their quality of life has gone down. Elderly people come, they can't even go and buy milk or vegetables. They are confined to the house. So that's because of the pain as well as the disability that is associated. I'm talking about the physical aspects. So we need to treat the pain. Foremost, we need to establish a rapport with the patient. We need to reassure them that together we will try and treat your pain and make you feel better so that you can at least carry on with your activities of daily living. That is ADL, so that simple things they'll be able to do. So we do what is called a multi-modal therapy because there's no magic bullet to treat chronic pain. So we start off with medications, and then we also, there are a lot of interventions that we can do to treat pain, different kinds of pain. So these interventions can be as simple as dry needling or complicated like, implantable devices and all those things. So the whole variety. And advances in medicine has made all these very, very safe and accurate, because most of the injections that we give are either X-ray guided or ultrasound guided, which has increased the safety and accuracy. So we do a combination of this, and along with physical therapy and advice on how to take care of your body, like doing reducing weight. Many of them are obese. Reduce weight, do regular walks, and even nutrition, we tell them what to take. What are the anti-inflammatory foods? What are the pro-inflammatory foods? Avoid the pro-inflammatory foods. So this is taking care of the body part of it. Of course, there are many more. I'm just telling it very briefly. And then, of course, social and mental aspects also.
So psychologically, depression definitely needs to be treated if it is present, because one of the symptoms of depression is pain. Somatic pain. So the people who are depressed will feel body pain also. So depression is definitely by cognitive behavioral therapy. There are hundreds of therapies to deal with. Definitely anxiety, because any kind of autonomic symptoms which are produced in anxiety also creates a lot of pain in the body. So they also need to be dealt with by various psychological methods. One of the things which I find very interesting is supportive psychotherapy. So this means having some interest in life, journaling, as you rightly pointed out earlier. Then having support groups, which is very, very important. Because if you have people around you who can listen to you or can be some source of help to you, it makes a major, major difference in the person's life. In fact, one of the groups, earlier both of us were with Fortis Hospital. So we were, then I was working with cancer patient relatives, the caregivers. So I had formed a group, who was similar in similar neighborhood. So they were like adjacent to each other, not very far away, like 5-10 kilometers radius, And the group was like, they helped each other out for simple things. If one is going to the market to get something, they will take everybody's list and buy things for everybody and bring them.
Sure.
Somebody is busy, so nobody's there to sit with the patient. So somebody will come and sit with the patient,
Sure.
including they were all, chanters of Buddhism also. So they would be chanting together, even over the phone. So it's not necessary that you have to be physically present to be able to help each other out.
Sure.
So mentally and emotionally, it was balancing out a lot many things.
In fact, in all the work that I have been doing around mental wellness, and specifically when I look at patients, whether they are chronic illness patients or chronic pain patients, or whether they are terminal illness patients or whoever, in my view, while the social or the mental wellness of the patients is important, the mental wellness of caregiver at times is just as important as
Absolutely.
well. And some of these diseases or some of these challenges, they are not necessarily an individual challenge. Of course, the individual is suffering the brunt of the actual pain, but they become a family problem. They become a social problem.
Because see, when there is lack of cohesiveness in the family, it leads to hostility amongst the family members, which is called expressed emotions. This really needs to be dealt with.
Sure.
And one of the things which we do very much with the patients is called acceptance and commitment therapy. So even despite what is acceptance is, you accept you have a problem, there is chronic pain, pain will persist, whatever one may do. So one has to learn to live with that pain. But one should have some cherished goals.
Sure.
So you should have something always to look forward to. Like, okay, this is my pain, but despite my pain, I'm still able to do my things.
Do this. Sure.
So that really helps patients.
Sure.
Like, for example, at about support groups, it so happened that one patient had come to me and she was a wreck. Family problems, severe pain all over. It's fibromyalgia. I don't know if you've heard about it, but it is pain all over the body, which has along with depression and irritable bowel and a lot of problems. And while I was just talking to her and understanding a problem, another patient of mine who had fibromyalgia, who had become much better. In fact, she was going abroad for one fellow scholarship. She happened to be waiting outside. So I just said, I just got an idea. Why don't these two talk to each other? So I just quickly called her in, and this lady, they had such positive interaction with each other. And this lady told that, don't worry, I was also in that situation, but there's an end to that tunnel also. And that worked more than what I was trying to tell you. So this is very important, this kind of a
Sure. And while I'm doing the work from a tech perspective in looking at mental health and how can we create a tech platform, one of the critical things that we are trying to do is actually the concept of support groups across various issues. And they are not just for people to share their experiences of how they got better, but it could be how they got better. It could be how they did not get better, or what did they suffer with and how did they suffer and what
were the barriers.
What were the barriers that they faced. It could even be a solution that comes from another provider or from another expert saying, here are the things that you could do. And then, more importantly, it connects everybody together. So when
we all know that they are, suffering to a certain extent, some more, some less, and how they benefited.
One of the person may talk about the psychological aspects of it. Another one could talk about the physical aspect of it. Another one could talk about the social aspect of it. Somebody could talk about how the committed caregiver experience need to be nurtured within the system. So I think that's a extremely important part of going through with such experiences. Now, alternative therapies. In chronic pain, specifically, if we think from an Indian perspective, alternative therapies have always had a huge role to play in any sort of healthcare. How do you determine from a chronic pain perspective what would be the most beneficial for a specific case, or do you recommend certain alternate therapies and how?
See, we believe that pain is treated multi-modal. Now, multimodally includes what I mentioned earlier, medications, interventions, physical therapy, and of course the psychosocial aspects. But there is a role for alternative therapy also. Because things like Ayurveda, where massage and oils are used, they do help because a lot of pain is myofascial pain, where the muscles get tight and are in spasm. So there is a role for the massages that Ayurveda has to offer. Or for example, yoga. Yoga is extremely good, but of course, it has to be tailored to that patient's problems. For example, a young person with back pain and an elderly person with back pain, they have got different problems. What's the cause of the back pain? So for an elderly person, certain yoga exercises may not be good. So you need to tailor it. So what I would say is that these alternate therapies do have a role along with your mainstream medicine, not a standalone medication. Sometimes it helps, but then when I treat patients, I believe that you can individualize a particular alternate therapy for.
Like yoga, we also recommend for people with anxiety-related problems. So with relaxation training, with other methods that we use, like maybe systematic desensitization or CBT, the cognitive behavior therapy. Yoga also helps, it keeps up, especially breathing exercises in yoga. So this really helps a person to control the anxieties also. But even stress-related problems.
Yeah, and I do a lot of dry needling to treat my patients. Okay, now dry needling is different from acupuncture. I treat the muscles and I relieve the pain. And I use it for starting from headaches to backaches to frozen shoulders, tennis elbow, name it, I can do dry needling all over. Now, dry needling, but along with that, sometimes I add a few acupuncture points.
Okay.
So acupuncture is also another modality that can be added on to your therapy. In fact, for post-chemotherapy, nausea, vomiting, there is a point which is mentioned even in our textbooks that particular point is good for preventing the nausea, vomiting associated with chemotherapy. So there is a role for acupuncture also, but like I said, not as a standalone therapy, but maybe integrated with the mainstream. Yeah.
Sure. So many people that suffer with chronic pain also experience isolation and frustration. Kind of comes as a package, I guess, for many people. What coping mechanisms or mental health practices do you think are beneficial for those people to manage their emotions alongside the physical pain?
See, one of the things, this is where supportive psychotherapy really helps. Firstly, we encourage people to really go out, to socialize. Have some kind of a support group, whether it's friends or neighbors or family or extended family whoever. Secondly, there are certain things like you can join the dance class. This really helps in movement, and the movement itself, a lot of chronic pain goes away. Journaling, very important. Having certain hobbies, indulging in those hobbies, just 30 minutes activities every day, something which gives you a lot of contentment within yourself. It makes you happy, right? Then any kind of thing like art therapy or what other kind of therapy, like any of these, any
of the performing arts,
therapy, any performing arts, that really helps because basically, and we don't encourage them to do it in isolation at home only. So maybe once or twice you go out, mingle with the group, make friends there. And that really helps. The socialization helps a lot amongst, and once you are emoting out, and actually the endorphins in the neurochemicals in the brain, they get developed. They actually act as anesthesia for the body, so you don't feel pain.
In fact, just laughing, full-throated laughter increases the serotonin. That has been proved.
Yes, actually.
And pediatric cancer patients, their parents are going through a lot of stress, seeing their child with cancer. So this dance therapy and all, the mothers of the cancer, the children, they all get together and dance and let go of their emotion. It really helps.
In one of the things about journaling, see, what we advise them is, you write whatever is coming to your mind. One doesn't have to compose and write something.
Right.
Whatever the thoughts are coming, you keep writing down. Then there is some sense of relief within yourself. Then we ask them, just tear it up. Don't go back and read it because then it is more firmly in your head. It's like revision, right? So don't go back and read it. Just tear off the pages and then think of one positive thing. Either write it down or imagine yourself in a pleasant situation. So that gives a feel good.
Sure.
So this is something which helps a great deal.
So managing chronic pain empowers a patient to regain control of their lives. What would be your message to those that are struggling with chronic pain and how can they find support and resources to manage their conditions effectively?
Would you like to answer this first? Alright. So basically empowerment means you feel that now despite your pain, you can still function alone and independently. This is very important. How do you do it? So you learn to take onus upon yourself that yes, despite my pain, whatever it is, to whatever level it is, I take onus upon myself to get myself treated so that you don't develop a sick role. Then secondly, you do as much as possible whatever activities you can. So you feel that yes, despite my pain, I'm still productive. It's very important to feel that I'm relevant to the society, I'm relevant to my family, and I'm relevant to myself also. Right? So this is what we aim for. And secondly, doing small activities every day, every single day. That is what is very important. Like one can, in fact, one of the patients, I asked the person that when you're feeling alright, what do you feel like doing? So he said, I feel like doing many, many things. So I said, why don't you do it? What stops you? He said, no, I feel, the pain will come back. I said, pain will anyways can come back. So that is should never be a deterrent in your life. So whatever it is, you go ahead and do it that day. It will give you a sense of satisfaction. Whatever you can do. The days is
the fear of dependency.
Yes.
Many of these people who come, particularly with spinal problems who cannot walk, they are worried about, I don't want to be dependent.
Yes.
You see, I don't want to lie in bed. I want to do my own self-care activities.
Sure.
So that otherwise they feel that I've become a burden on my family and that kind of a feeling. So that is one of the most common fears. So that is what we try, together we try to tell them that, we try to get you somewhere where at least you can take care of yourself.
Sure.
And then there are the days which are bad days. So I tell my patients, I say, just pamper yourself.
Sure.
Today's a bad day, lie down in bed, listen to music, see movies, do whatever you feel like, and just get it over. Like pain goes away after some time. And then re-begin the next day.
Sure. One of the important aspects, and I've spent quite a bit of time living in the US, and of course, for the last many years, I've been in India. One of the differences that I see is we are a very curative society versus a preventive society, and we learn to adjust with things versus directly dealing with them. And I think many times I see people, and it almost seems like some of the chronic pain kind of issues. Many people, instead of really looking at how can they uplift themselves or how can they go beyond that, would just adjust with it. I mean, is that an aspect that you see in your experiences?
Yes, we do see that. And this is not a good way of going about, because preventive is some things like right from the beginning, from our childhood, we should teach our children, take care of, be physically active. Instead of these days, kids are sitting right in front of the TV most of the day, becoming obese. Children hardly go out to play. They prefer playing video games than actually going out and play. So we have already started building the problems for them right from their childhood. So yes, being physically active, having good nutritious food, this is right from the beginning. This needs to be trained, and of course mentally, not socially, having virtual friends, but actually going out and making friends and socializing with children of your own age, developing interests in life. Instead of passive thinking of just videos and things like that, it kills the creativity in a child. So right from the beginning, this needs to be done, not once the problem has started.
So in this digital age, where we have constant connectivity and information overload of all kinds, embracing holistic well-being can sometimes be a challenge. And you talked about how kids will only sit in front of the TV and everything. But how can technology be leveraged to support the physical and psychological problems that are associated with chronic pain management?
See, digitally we can, especially for the older group, this I would say, being in touch with people even over the phone, like video calling and things like that, is a support to them. So even seeing their children, so many we are coming across where the children are living abroad and the old parents are here, there's nobody to look after them. So their life is still revolving around those children. What they are doing, what are the grandchildren doing, things like that. Another thing which we always help, and at least I push my patients to, is have your own interests in life and have your own social setup. It's very important than just talking to your children or just isolating yourself as husband or wife whom to speak to, everybody is busy. No, if people are busy, so what? You go out and venture and try making friends, in the neighborhood, people of the same age, retired people. In fact, there's a very nice group here in Vishali itself, when I came to know about it. So this old group, they have these health camps and things like that, whoever are the active members. So they call all the other people, and for older people only, they have these health camps or these laughter groups, or even putting up small plays, discussions, somebody coming, and even I went and I gave a talk on chronic pain only. So you understand, so this kind of camaraderie which is there, which I found amongst the group, it was very welcoming, very heartening to see. So this is where the digital, because they are all connected to each other.
Sure.
All the members in that society are connected to, whether you want to or you don't want to, but everybody is a member.
Sure. So living with chronic pain, sometimes can be a very lonely journey. Not just lonely in terms of an individual's lonely presence, but experiencing pain is their own, unique kind of experience for themselves. Can you discuss the importance of building a support network, and what kind of a role can friends, family, and support groups play for such patients?
Yes, I think all of them do play a very, very important role. As I said, joint family system as far as possible. This is really my message to the people who are listening. Please don't let this go. This is one of the USPs of our country, joint family system. Because the young and the old, everybody is looked after, right? The family, I would say, whether it's children towards the parents, parents towards the children, if you are always in constant touch with each other, it in itself is a very huge emotional support to any person with any kind of problem. Leave alone chronic pain.
Uniqueness of our country.
Sure.
Yes.
Because I'm telling you, I see people coming. They're either the husband or the son. They're so caring. They come with the patients. So and I've heard husbands telling that she has pain here and her pain increases at night, and when she moves I hear her groan. He knows the details of her pain. So this is something so good in our country. It never fails to touch me when I see this. We have that commitment towards a family, commitment to each other. They are not lonely.
Sure.
Whereas in the West it's so different.
Sure.
You see that this is something really unique about our country.
One of the other things that I have seen or I have learned in my experience is this: instead of having one caregiver being responsible for the patient, it is great if you can have multiple people be responsible for multiple attributes. Because if you have one caregiver and that caregiver is the one that is responsible, a feeling of hostility, a feeling of disbalance will occur at some point in life.
See, it's very physically draining out even for one person to look after.
In fact, in this book, we have written a lot about caregiver stress
Yes.
and expressed emotions. That the stress that they go through is tremendous.
Right. And the stress that they would reflect upon
Yes,
a patient that may already be struggling or suffering.
Not only upon the patient, even on others.
Even
They
on others.
interact with, they get impatient, short-tempered, and angry. It changes them completely.
Yes.
Yeah.
Yep. And as healthcare professionals, one aspect is your role well-being, but more importantly, you see all this pain all around you all day, every day. How do you take care of your physical, but more importantly, I'm also very interested in how do you take care of your mental well-being yourself?
See, I used to always think, that because I'm also emotionally, I get affected when I see pain and suffering. So I used to always wonder how am I going to handle it. But then I think that we have been placed in that for a particular reason.
Sure.
And I think I would say I'm almost privileged to be in a position where I can help people. And that sort of gives me some inner satisfaction. And that can take care of my mental well-being, knowing that, God has placed me in this situation, that I should just not be there for my family, but I should be for the others suffering in pain and try to alleviate it to as much as possible, whether it's cancer pain or non-cancer pain. So I just take it as a challenge. And there are some times I do get affected when I see particularly terminal cancer patients, but then something else surfaces in me and I know that this is a unique opportunity for me to give some kind of a relief.
Sure.
Few things which I would like to add here. See, I personally, I have a lot many interests in life. So, two which are very predominant is one is reading and one is writing. So it gives me a lot of comfort when I do these things, and I do it on a daily basis. There's no single day when I do not read and then sleep. I mean, I just cannot sleep unless and until I have read something.
Sure.
Secondly, 10 minutes of introspection is very essential. Anything which has disturbed me, anything, any patient, it's not just chronic patients, even my other patients, anything which affects me, I do have a self-talk as to why did I get affected, what happened within me. That is very important because it's very comforting to know yourself for sure and your own reactions. This is something I would advocate, please everybody do it.
Sure.
It really eases out a lot of emotional stress within oneself.
Sure. So
And also to have some hobbies.
Sure.
You see, she mentioned about what she loves. I like to do painting, I like to do bird watching, I like to do gardening. So you should have some of your own hobbies that give you pleasure. That also helps in well-being, physical and mental well-being.
So one of the things that I always say is, mental wellness for every individual is so uniquely positioned for them only. And if you are able to look at what stimulates you, let me not just use the word hobbies, but what stimulations you have. And if you are able to reflect upon it, if you are able to work through them, I think that is extremely pleasing for most people. And specifically regarding reading and writing, one of the things that I have been talking about for many years now is if you take academic books and research books and you keep them aside, 90% of all authorship and 80% of all reading happens from a mental wellness perspective, or it has certain mental wellness elements to it, whether it is authorship, whether it is readership. Of course, academic and research books aside, there will be a lot more academic knowledge and everything that will be incorporated. But outside of that, I think there is a huge element of mental health that is incorporated within the entire culture of reading as well as writing.
Absolutely. I agree there.
Okay, and while I was listening to your amazing answers, I was actually kind of feeling or thinking about the soul wellness work that I have been part of for the last few years, and thinking about how, in terms of whether it is in terms of creating support groups, whether it is in terms of providing people a platform so that they can journal, or whether it is helping people with capabilities in terms of allied therapies through which they can support or through which they can further progress in their stimulations. I think there is so much more that needs to be done from a mental health perspective, specifically as we are looking at patients with chronic pain. Dr. Mary, Dr. Vandana, thank you so much for being a part of the Solh Talks show. Dr. Vandana, this is a token of appreciation from us at Solh. This is what we call as our calmness helper.
Thank you.
This is a token of appreciation from our side. Thank you so much for being part of Solh Talks. And Dr. Mary, thank you so much for being here. Thank you so much for being part of Solh Talks and for giving your wise words on this platform.
It was a pleasure.